Next up, we have a very interesting startup. They have been working in the tier 2, 3 and rural areas of India and trying to create a social change. So I would now like to request the country head of Lab SD, Ruri, to present.
Namaste, good evening everyone. My name is Ruri and I represent Lab SD for Indian operation. First of all, I'd like to thank you for joining today's demo day. I hope you're enjoying. So Lab SD, we started from this problem, the global blindness. This is a big problem considering that there are 253 million people who are either blinded or visually impaired in the world, and most of them live in low and middle income countries due to the shortage of health infrastructure and health human resources. The good news is that most of the diseases are preventable by one time of screening and treatment. However, early diagnostic of the retina-based eye diseases is very important because they are stoppable but irreversible. And in India, there is high prevalence of blindness and visual impairment, and with the rise of the diabetic retinopathy as a complication is expected to be the leading cause of blindness in India. More fundamental problem behind the blindness is the poverty caused by it, which means the more you are poor, you will be more likely to be blind, and if you're blind, you will become poor more easily. So the problem we want to solve in one line is to eliminate the preventable blindness in resource-limited conditions and poverty caused by it. Members of Lab SD has been working to solve this problem for the last 10 years in the field of global eye health as a researcher, NGO worker, and finally as a startup. So based on our experience and expertise, we're proudly proposing iLike as a solution. iLike is a digital eye health solution consisting of one, cost-effective digital ophthalmoscope that screens retina-based eye diseases. Second, AI-based clinical decision supporting system and teleophthalmology system. And three, the health information system. I'm gonna tell you how they work organically to solve the problem. Firstly, the cost-effective digital ophthalmoscope, which functions with smartphones, will be placed in the primary healthcare center in the marginalized area. And any health professionals in the center who don't have any diagnostic knowledge will capture the patient's retina images. And once the images are collected through the iLike mobile application, they will be transferred to the health information system where doctors will provide the telemedicine service. So as a result, we can solve the problem of shortage of the proper diagnostic tool and health human resources. And on top of that, we're providing AI-based clinical decision supporting system to better support the health professionals' diagnosis on the spot. And talking about how cost-effective our device is, its prices is under 1,000 US dollar, which is the 1/30th of the conventional devices in the market. And now you may wonder how this innovation was possible. We could keep the price down by using the used smartphones in collaboration with the used smartphone providers. So the pictures we are drawing together is extending the smartphone's product life for the circular economy and promoting the eye health of people at the same time. Isn't it wonderful? And furthermore, we are currently developing online donation module to achieve the patient's continuum of care after diagnosing. And iLike has been under pilot projects in 5 different countries, including India, with 4 different prestigious tertiary eye hospitals. And during the pilot, we have screened 37,000 patients and raised $3 million US as funding. And based on the successful pilot projects, now we're at the stage of commercialization. The first phase of the business model will be the sales of devices and software, which will be advanced to the provision of AI services, and finally to the big data analysis. We plan to enter India market in early 2024. We have established the company here, and the medical device registration is in progress. And we were able to build the distributor networks through this KSC program. And while doing the business, we'll create 120,000 jobs, and we'll screen more than 650 million people. And we see the market size in India is over 100 million US dollar, most of solely from the eye healthcare sectors. So for the first 3 to 5 years, we'll focus on securing the opportunities in NGI hospitals and the private eye clinics in tier 2 to tier 4 cities. And we will move on to the governmental procurement system in the next 10 years. So the one lesson we have learned in the last 10 years is that we cannot solve this problem alone. That's why we're defining iLike as an ecosystem, inviting different partners from various fields. Will you be joining LabS's journey to eliminate the avoidable blindness? Thank you very much. Do you have any questions?
Well explained, Ruri. Thank you so much.
Sustainable means, could you elaborate your question? Yes, sir. So we have our in-house development team, and we also produce hardware by ourselves. Thank you.
Thanks, Ruri.